Cannabis oil, aka CBD, is another type of cannabinoid that is a natural chemical found in cannabis. CBD comes specifically from the hemp plant, which is a part of the cannabis family. Unlike THC, CBD doesn't intoxicate you in order to feel that high you'd relate to cannabis. There has been many questions as to if it's possible that CBD could help treat or relieve anxiety. Because of CBD's growing popularity over the years, there is now some promising research regarding its effectiveness in treating anxiety. In today's video, we're going to be taking a look at current understandings and research in order to find out how or if CBD oil helps with treating anxiety. Stay tuned. First, we need to talk about how CBD works. The human body has multiple receptors. The receptors in our body are protein-based structures made out of chemicals that are attached to our cells. The receptor's job is to receive signals from multiple different stimuli. The CB1 and CB2 receptors are what CBD is understood to interact with the most. These receptors can be found within our central nervous system. Although it's not completely understood how CBD and CBD1 interact in the brain, this is believed to alter our serotonin signals. Serotonin is a neurotransmitter that plays a vital role in our mental health. Depression is commonly linked to low serotonin levels, and in other cases, not having enough serotonin can lead to anxiety. Ways to increase serotonin are through having a diet rich in L-tryptophan, having good and consistent sleep, and having adequate vitamin D. There are also plenty of other ways to increase it. A common treatment for low serotonin is SSRI, aka Selective Serotonin Reuptake Inhibitor. However, CBD is linked to stimulating our endocannabinoid system, which is responsible for these similar emotions of bliss. So, some people with anxiety may be able to treat their condition with CBD. Now, it's time to get into some research and evidence. There are many studies out there discussing the potential benefits of CBD for generalized anxiety. Generalized anxiety is classified as a disorder, GAD or generalized anxiety disorder. The National Institute on Drug Abuse claims that CBD is reported to show a reduction in stress on animals such as rats. The subjects were observed as having lower behavioral symptoms of anxiety. Also, the physiological symptoms like increased heart rate improved. There are other forms of anxiety such as social anxiety disorder or SAD, post-traumatic stress disorder, panic disorder, and insomnia. Healthline states that many studies have shown CBD can help with PTSD symptoms like consistent nightmares or constant replays of harmful memories. These studies looked at using CBD as a treatment to PTSD and also a supplement to traditional treatments like cognitive behavioral therapy. Another study conducted in 2011 looked at CBD's effect on people with ASD. The participants were given a dose of 400 mg of CBD or placebo. Those who received CBD experienced overall reduced anxiety levels. Medical News Today states that in a 2020 study, researchers tried to determine the effects on CBD in 397 adults living in New Zealand. The participants received medical CBD prescriptions for a variety of ailments that included cancer-related symptoms, neurological symptoms, and lastly, mental health symptoms. Participants in all groups reported that their overall quality of life after 3 weeks of CBD treatment improved. The individuals who received CBD treatment for anxiety or depression reported that they had seen noticeable improvements in their ability to carry out daily functions, which in turn led to a reduction in pain, anxiety, and depression-related symptoms. 70% of study participants reported a level of satisfaction when using CBD treatment, ranging from anywhere from good to excellent. Furthermore, only 9.9% of participants experienced adverse side effects such as sedition or vivid dreams. An even smaller portion of the study population had worse symptoms, 0.8% to be exact. In a retrospective study, the researcher looked at the effects of CBD treatment in 72 adults with either anxiety or sleeping problems. Most of the study participants received one 25 mg capsule of CBD once a day, and the other amount received 50 to 70 mg. One individual was reported to have a history of trauma and schizoaffective disorder and received up to 175 mg a day. After a couple months of treatment, roughly 80% of participants reported improvements in anxiety-related symptoms. However, roughly 20% of the subjects developed worse symptoms again. The authors of one 2020 article reviewed 8 studies investigating CBD's role in treating a wide variety of disorders. This shows that CBD could be a working therapy for generalized anxiety disorder, social anxiety disorder, and post-traumatic stress disorder. But it does seem the level of dosage plays a significant factor in these studies, as they were ranging from 6 to 400 milligrams per dosage. This research is extremely insightful. CBD has been used in a wide array of disorders, including neurological disorders. However, a 2017 literature review on CBD and psychiatric disorders came to the conclusion that there is not enough evidence to suggest that CBD is an effective treatment for depression. Although there have been studies to show CBD could possibly help with anxiety disorders, these studies were uncontrolled. This means that the subjects weren't compared to a controlled group that might have used a different treatment or none at all. Based on this, more human tests need to be carried out in order to better understand how CBD works and what the ideal dosages should be, especially to find out if there are any potential side effects or hazards. So if you're interested in trying CBD oil, it's best that you talk to your doctor so they can find out what starting dosage is right for you. Here in a 2018 study, it says that male subjects receive CBD before undergoing a simulated public speaking test. The researchers found that an oral dose of 300 milligrams administered 90 minutes before the test was enough to significantly reduce the speaker's anxiety. Members of the placebo group and study subjects who received 150 milligrams saw little benefit. The same was true for subjects who received 600 milligrams. The study only looked at 57 subjects, so it was small. So with this in mind, it seems more research is needed in order to determine the appropriate dosage for people with anxiety. CBD is generally considered safe. However, as seen, somebody who takes CBD may see side effects, including changes in weight, fatigue, diarrhea, and changes in appetite. So, to conclude, it's possible that CBD could help treat anxiety, but research is still ongoing and ever expanding. The FDA does not regulate CBD for treating anxiety, and the quality of your dosage can vary widely between different products. So, if you're looking at CBD to help with your anxiety, check with your doctor to ensure CBD won't affect any current medication or supplements you're taking. Well everyone, we hope you enjoyed today's video. If you're looking at taking CBD oil, broad spectrum that is, on our website we sell CBD balm, oil and capsules. Expect more videos to come talking about CBD oil, how you should take it, and much more. If you want to try it out for yourself with some buddies of yours, you can send a coupon to your friends and you both benefit from £10 off your next order. To stay up to date, make sure you hit that subscribe button and ring that bell. We'll see you next time.